You're watching Fox 10 Arizona Morning with Ron Hoon, Rick D'Amico, Andrea Robinson, Kristen Anderson, and Corey McCloskey in HD.
But in the meantime, this caught my attention this morning. Early this morning, I was going through the paper, you know, scanning the headlines, and wow, it said there's a new link between breast cancer and breast implants. And there was that scare for a long time with the silicone
breast implants.
And then they went to saline, and they said that was okay.
Right, but now a lot of doctors are using the silicone again. It's kind of a patient preference, whatever they would like to, you know, silicone or saline.
So we need to know, is this a threat from the saline or the silicone?
Or the silicone, yeah. And so women who have implants or are considering having them should really pay attention to this, because the info could essentially be life-saving. Alexis Vance has more on this new study.
Good morning, you two. The FDA says this is a small but significant risk, and they have found a link between saline and silicone breast implants and this very rare cancer. To tell us a little bit more about it, we're joined by Dr. Robert Kuske. He is with Arizona Breast Cancer Specialists, and I heard your office has just gotten so many phone calls since this news broke, and I guess the big question first is, what is the name of this cancer and where does it form?
Well, this is a very rare cancer called anaplastic large cell lymphoma, and it's very rarely seen in the breast. It's seen in only 3 in 100 million cases in women without the implants. But with these silicone implants in the breast, the numbers bounce up to 1 in 500,000. So that's a big bump, but still women need to know that it's a very rare problem, even in women with these implants.
And where exactly on the breast does it form?
Well, this is a mammogram of a woman with this implant, and in reaction to this foreign body being inside the breast, the body sends white blood cells to attack the foreign body. And some of these cells have a risk of becoming malignant because they're very active on the surface of this implant here. This is a saline implant, and here is the breast tissue. So it forms as a smooth thickening, not as a marble like breast cancer, but more of a thickening or a plaque along the surface of the implant, so it presents differently than breast cancer does.
So what are the symptoms? Because so many women do have breast implants, and they're probably at home right now really worried.
1 in 3 of my patients here in the Valley have these implants. They don't call Phoenix Silicon Valley because of computer chips. They call it because of the breast implant.
Right. So
my phone's been ringing off the hook, and I'm reassuring women that they need to be forewarned is forearmed, but do not panic because it's a very rare malignancy.
Okay, so what should they be looking for?
Well, self-breast examination is still recommended, and women with implants, it's easier to examine the breast because of the implant behind the breast tissue. So what they're looking for is a smooth thickening of the implant, maybe a firmness or a hardening, not a marble like breast cancer, but like a plaque in front of the implant. And if they sense any change, they should present that to their doctor and say, hey, my breast feels differently, will you examine me? And then subsequent tests can take place.
What's your advice to women getting implants or thinking about getting implants now that this news is out?
I don't think they should change their opinion. Cosmesis is important to women in America, and this is so rare that if they want to have their breast implants, you go, girl.
But it's still good to know, you know, it is a rare cancer, but at least you know it's out there, you know what to look for, and it's always good to be informed, but not scared, just informed.
Yeah, be aware of your breast and know the architecture of your breast. Examine yourself regularly. Any changes, go to the doctors, but please do not panic with this report about a rare lymphoma.
Okay, Dr. Kuske, thank you so much for joining us this morning. So, you guys, the FDA does say they need to do more research. They need to look at more numbers, but the information is out there, so we wanted to share it with you. But again, no need to panic. Just be aware.
Right.
All right. Yeah, you know what? It doesn't hurt to know about this.
That's what we do here.
Yep.
We put the information out so you know what's going on.
Exactly.